Okay, this video is about one of our members of the vegan community. This right here is Dr. Esselstyn, and the question is Dr. Esselstyn crazy? Or what's the alternative consideration? This picture, by the way, is a picture of him with his son, kind of like the creation. In case you don't know him, Dr. Esselstyn is this guy. He is world famous. He came up with the cure for coronary artery disease with a low-fat vegan diet, no meat, no sweets, no oil, no caffeine. He's got real long arms. He's about 90 years old. He's got these thick, Coke bottle glasses. He walks around on stage. He kind of looks like a giant grasshopper with these long arms. And he always said, eat that diet, and he has the best results. That's all published and documented and proven. But lately he's been saying something different. He's been saying, he wants you to graze on greens all day long, at least 6 servings of green at 6 different times. And it kind of sounds like a pain in the ass, quite frankly, to have to do that. On the one hand, you could say it makes physiologic sense that humans match herbivore physiology. Maybe like a herbivore, we should graze all day. Dean Ornish had previously used the phrase amazing graze. So is it really such a good idea? And who cares? All right, well, like I said, this is a new thing, him talking so much. He's got a nice video where he's interviewed by his son on Plant Strong is the name of his son's YouTube channel. And what Esselstyn says is he wants to keep bathing your arteries in nitric oxide. So nitric oxide is a real powerful vasodilator. It's the most important vasodilator in the human body. It's increased by Viagra and the Johnson. And what's been going on, he's been hanging around with Nathan Bryan. Nathan Bryan is a PhD guy who did his PhD and his postdoctorate studying nitric oxide. So he's kind of like the world expert on nitric oxide. He's got a YouTube channel. He's got some pretty good videos if you want to learn more about nitric oxide. So anyways, nitric oxide goes through a conversion pathway where it's activated. When you eat the leafy greens, it goes in your mouth. And on the top of your tongue, you got these bacteria that convert the nitrates, it's a nitrogen with 3 oxygens, into a nitrite. That's a nitrogen with 2 oxygens. And then it goes down your esophagus into your stomach. In your stomach, the gastric acid in your stomach will convert the nitrite, the nitrogen with 2 oxygens, into the nitric oxide with 1 oxygen. Then it's absorbed into your blood and has a diffuse systemic vasodilator effect, lowers blood pressure. It's good for your health, helps lower your risk of atherosclerosis. Okay, nitric oxide also, a big thing to know about it is that it inhibits platelet aggregation. That's actually good news. So it prevents blood from clotting. That's actually good news in a surprisingly important way. Now, I'm also going to tell you, I haven't seen the paper yet. Yeah, sure, he talks to Nathan Bryan. Yeah, sure, he says this is great. Does it really work? I don't know for sure if it does, but I'm just telling you, and that's kind of what I'm getting at. Is Dr. Esselstyn going crazy telling us we need to chew greens all day? Is he just being obsessive? Is he exaggerating? Is there proof of this? I don't know. But why am I even talking about it? Why is this potentially a huge, giant, super big deal? I'll tell you why, and here it is. Do you see the elephant in the room? Do you see how this could be wonderful? The point is, if grazing on greens really truthfully does increase nitric oxide and does truthfully improve oxygen delivery to all your tissues all day long, do you see what an incredible big deal that could be? Do you get it? And it prevents platelet aggregation. Do you get it? Famous survivors of metastatic cancer, Chris Wark. He's the guy who wrote the book, it's called Chris Beat Cancer, and he always says he eats this giant salad every day. I think he maybe even every meal. He eats a lot of salad, all right? Ruth Heidrich, PhD lady. She always starts her meal, she says, with a giant bowl of salad. And these are like 2 of the most famous metastatic cancer survivors in the world. Ruth Heidrich, she had metastatic breast cancer at 42. She's still running, marathons in her 70s and even in her 80s. She's like, I work out every day, this grandma lady. She's really nice, and she wrote us a book too. Senior Fitness is one of her better books. She wrote a couple books. Both of them got lectures on YouTube and stuff. Okay, they both eat tons of salad, world famous metastatic cancer survivors. Okay, so what am I getting at? Well, gee, if eating greens all day really does increase the amount of oxygen delivery to your tissues, maybe, I don't have any proof of this, but maybe logically one would think that might increase oxygenation of tissues, that might decrease the ability of cancer to grow. I would definitely, if I had cancer, man, I'd look this up and find this out and do it if it worked. Maybe preventing platelet aggregation will help, because the platelets will form little clots around the cancer cells in the blood, and they'll shield them, because when an immune system cell comes, it'll bind to the platelet to check its immune identity, and then the cancer cell's hiding underneath. So let's say this is the cancer cell. This is the cancer cell right here, the red thing, and my hand would be the platelet, and the immune system cell would be, let's say, this, immune system cell. It comes over and it binds, and it'll bind to the platelet, and it can't see the cancer cell, because anytime it tries to see the cancer cell, there's a platelet covering it, okay? So that's how platelets act when they're activated excessively, which can happen for a lot of reasons, including excessive psychological stress. They hide the cancer cells from the immune system, so the immune system can't remove them, and you increase your risk of metastatic disease. So what I'm basically saying is Esselstyn is either crazy or he's a genius, and he's maybe figured it out indirectly. You've got chocolate in my peanut butter, penicillin. He's maybe figured out a thing that would really help cancer patients. If he can hyperoxygenate their tissues in a safe way, he might slow the growth of cancer, because when you oxygenate tissue more, you're going to decrease hypoxic inducible factors, and that whole cascade of reactions, transcription effects, epigenetic effects that happen from the hypoxia of the tissues. And you're also going to make the platelets less aggregating. You might be protecting. I don't have any proof of any of this, but I'm just saying, theoretically, this is incredibly good news if it's true. And it might be true, because Esselstyn is usually not a BS artist. I haven't caught him ever BSing before. So, he's about 90. Maybe he's senile, but and I haven't seen the paper yet to prove it, but I think he's maybe onto something.